afternoon, and thank you for joining me in this lecture about Malassezia dermatitis. It is a pleasure to talk about this disease that is very common in small animal practice in our days. This presentation will allow you to diagnose and understand this challenging disease. With the diagnosis, you will be able to decide for the appropriate treatment and understand the rationale behind the treatment choices available nowadays. So, let's start. First, we are going to talk about the dog, and then second, we'll talk about the cat. Now, let's understand a bit about the dog microbiota on the skin. The microbiota before, we thought that the most common species was Malassezia pachydermatis, because in the past we were using cultures to identify the Malassezia. Now, in our days, we have molecular technology, and molecular technology allows us to identify the species in a much more reliable way. And now we know that the most common species in the dog skin is Malassezia restricta, so that's the higher number, followed by Malassezia pachydermatis, and then in the lower numbers, we'll have Malassezia globosa. And this is the skin of a completely healthy dog. Now, what happens in a dog that is allergic? Even if the patient doesn't have any lesions, we know that an allergic patient will have what is called a dysbiosis, because it has an ongoing inflammation. Even if it's only microscopically, it has an ongoing inflammation, which allow to change the numbers of Malassezia, the species of Malassezia. So we will have in the dysbiosis, which in fact is characterized by a higher number of Malassezia pachydermatis compared to a lower number of Malassezia globosa, Malassezia restricta. Now, this means that Malassezia pachydermatis will be the most abundant species in the non-lesional allergic skin. So we have what we call a dysbiosis with loss of diversity. And dysbiosis, along with the defects of the skin barrier that are common and are present on the skin of an atopic dog, plus the chronic inflammation, will predispose this patient to Malassezia dermatitis. In fact, the dysbiosis will make the defects of the skin barrier worse, and also will make increase the inflammation of the skin. So everything taken together, we will have a Malassezia clinically Malassezia dermatitis with inflammation of the skin, more inflammation, or Malassezia overgrowth, not much inflammation. And we can also have Malassezia otitis. Okay, so now we understand more about how this relation happens. Now, we also know from the past that that they are breeds that are predisposed to Malassezia dermatitis, and that includes West Highland White Terrier, the English Setter, Shih Tzu, Basset, American Cocker Spaniel, Boxer, Dachshund, amongst other breeds. So the breeds will depend many times on the area of the world is located the practice, because we know that the breeds vary between countries. Now, if we need a dysbiosis to have Malassezia pachydermatous proliferation, that means that we have a concurrent disease. So we have an underlying disease for this problem. As I said, most of the times we are looking to allergic patients. We are looking to patients that have atopic dermatitis, so allergies to the environmental allergens, and or allergies to the food, so a food allergy, or both. So allergic patients are the number one cause behind the Malassezia dermatitis, or the skin, or in the ears. There is also a possibility that the patient is not allergic, but will have defects on cornification or endocrinopathies, or potentially any disease can cause proliferation of the Malassezia due to the fact that it interferes with the skin microbiome. Now, in the past, we used to say that folds can be by themselves a predisposing factor for the development of Malassezia overgrowth locally. Now, there is a more recent publication in dermatological problems of brachycephalic dogs. And they have found that Malassezia, in fact, when the Malassezia is on the fold, it tends to be secondary to the fact that the patient has atopic dermatitis or food allergies, or less likely ichthyosis or pemphigus foliaceus. So, in fact, what we can take from here is that if we have a brachycephalic patient that is having recurrent Malassezia overgrowth on the fold, we should look, check if this patient has an underlying disease. And very common, we will find again an allergic problem. Okay, so how are we going to recognize the clinical signs of Malassezia dermatitis? Now, one common sign is, without any question, is pedal pruritus. Someone will say he licks and he licks his feet. And this pedal pruritus can affect the front limbs, the hind limbs, all of them at the same time. And this pedal pruritus normally is associated with erythema between the digits, as we can see here in the first picture, and also sometimes the presence of a brownish seborrhea between the digits. The hair might become stained with a brownish color. In fact, the erythema can become quite severe, and the patient will lick and lick the feet. And that's when you look at a patient that has these clinical signs, it's important that you do a skin cytology, which is the way to do the diagnosis, as you will, as we are going to see in a few minutes. Okay, going on with the clinical signs, another clinical sign that can cause also lots of feet licking is Malassezia paronychia. And in this case, Malassezia is on the nail bed and will stain the claw with a reddish brown staining. Again, the patient will lick. Most of the time, in my experience, the nail paronychia is associated with the interdigital Malassezia overgrowth, but I have seen cases where we only have Malassezia paronychia. So make sure if you, when you're examining the feet of your patient, make sure that you look at the nails and look at the nail bed.